it's your last skill. So yay, you made it, right? Well, we're going to do trach suctioning and trach care. The very first thing I'm going to do today is I'm going to show you how to do trach suctioning, and then we'll get into trach care. No matter what, when you have a patient who has a trach at the bedside, you need to make sure you have a couple things. You need to make sure you have a 14 French suction catheter. All right. You need to make sure you have a trach the same type in size as the one they have in. And then you need to make sure you have a trach the same type and one size smaller than what they have in. And an obstruator. Most of the time, the obstruator is in with the trach, the extra trachs, but always make sure you have them. All right, so we have what we need in our basin right here, so we're gonna put it there. Then you need to make sure that you have suctioning, a suctioning canister, and oxygen. So I'm gonna come over here, and I'm gonna check my suctioning, and I'm gonna check my oxygen. Our suctioning should be at 120 to 100, or 100 to 150, roughly around 120. When we hyperoxygenate, we need to have them on 10 to 15 liters. All right, so for psychomotor in Skills Lab, when we turn on our units, you're going to turn them on a timer over here. In the hospital, the units are already on and going, but you do need to make it a good habit that whenever you're caring for any of your patients, you check your equipment to make sure it's working. All right, so I'm gonna go ahead and get this turned on. I'm gonna check. All right, I'm at 11 liters, I'm good there. My suctioning, I need my glove because I am not touching the end of that suctioning line with my hand. Sorry, Miss Jones. Okay, so I have it on regular, so that means continuous, right? And I'm going to just put my glove over it. Oh, and it's not turned up. There we go, there we go. All right, way too high now. Gotta go down. All right, we're at 140, so that's between 100 and 150. I'm good there. All right, reach that back over there. All right, grab my gloves, grab my hand hygiene. All righty. Hi, Miss Jones, how are you? You sound a little congested. Maybe some adventitious breath sounds there? Yeah? Do you feel like you need suctions? So she tells me, but I still need to do my assessment. Before you suction a patient, you have to do an assessment because you need to have that documentation on why you're suctioning. So put my gloves on. Got my stethoscope. All right, I'm gonna listen. Okay, I'm gonna listen bilaterally under the clothes. Yeah, you definitely sound like you're congested. Okay, so I'm going to have you hyperoxygenated at 10 to 15 liters, which I already have. I checked my suctioning. I'm good to go. Make sure you keep your stethoscope right here. Okay, and you're going to see why it can be very difficult here in a second because you're only going to have one hand to put it in your ear. All right, so I got this up. I'm going to go ahead and open up my normal saline. Okay. Take off my gloves. Right, and I'm going to put them in my trash can. I'm going to do my hand hygiene. All right, good to go. And I have my suction catheter, 14 French. It's really important that you know what size catheter you have. Okay. Woo, there we go. All right. Step back too far there. You've got a little box right here. The box inside needs to remain sterile. So when you pop this open, you're going to see the bottom of the box. Just very gently reach your hand in there and pinch it. Bring it straight out and pop it open. You can touch the bottom because the bottom is just kind of like the sand. It'll keep it sterile. Pop it open. Okay. Do not touch it. Don't touch inside. Leave it alone. Grab your solution and you're going to pour. All right. And hopefully you don't pour it on your table like I just did. inside your suction kit here, you're going to have the suction catheter and you're going to have sterile gloves. Now, I know we've talked about the glove fairy before with urinary. You're going to have a glove fairy, I'm sure, with trach as well. But I will promise you, if you have a trach patient in the hospital, their gloves are going to come like this. So make sure you just bring an extra pair of sterile gloves with you. All right, so I'm going to put my sterile gloves on. Just leave it be. I have 2 sterile hands right now. That's awesome, that's great. The hand closest to the patient is going to become my non-sterile hand. All right, so I'm going to take my sterile hands and I'm going to grab my catheter. Got it? My non-sterile hand. Sorry, Miss Jones, I didn't mean to hit you in the head with the line. And you're going to connect. Make sure you get a good connection, okay? Because it can pop off. Be careful to not touch from here down with your sterile hand. And then very easily, just take off. There you go. All right. Check your suctioning. Make sure it works. It's good. I got lubricated with normal saline. And I'm going to wrap. When I go to suction, you're going to see that I'm going to dart into the patient's catheter with the line above my hand. That way I can see it at all times. I don't have to worry about it touching my patient or touching my arm. All right, Miss Jones, go ahead and take 2 deep breaths for me. All right, I'm going to move this. I'm going to unwrap and take your time, okay? Do not suction on the way down. You're going to feed it in. I hit resistance, pull back just a smidge, apply suctioning, and now you're going to twist as you're pulling out. Twist, twist, awesome. Wrap. Put that back on, re-hyperoxygenate them. You want to give them 30 to 60 seconds to recover. Now, this is why you need to put your stethoscope on your neck like this. All right. Make sure to keep eye on your catheter and your box while you are listening. All right. Ooh. You still sound a little congested. All right, I'm going to suction you one more time and see how that helps. All right. Take a couple deep breaths for me. Make sure to get this good and clean because it's not going to be as pretty as it is in skills. That mucus is going to be very thick and you could have several mucus plugs. All right, I'm going to move. Okay, again, dart, ready? Straight in. I'm going to hit resistance, which is your carina. Pull back a little and then twist, twist, twist. All right. How's that feeling? Yeah, take a couple deep breaths for me. Good. Keep that on there. It's not going to help you. All right, so I'm going to listen again. You feel better? Oh, I'm glad. I'm so glad you're feeling better. Let me make sure. All right. Oops, sorry. All right, you sound much better. Okay, great. I'm so glad. Guess what? She doesn't need suction again. You don't need to be sterile. You are done with trach suctioning. Make sure you document how many times you suctioned the patient, how well they tolerated it, how much came out, what the color was. All of that needs to be done. You also need to document why you suctioned and how they are afterwards. We reassess them. Their lungs are clear. They're no longer stating that they need to be congested. Their vitals, respiratory rate, SpO2, those are all great things. All right, now let's move on to trach care. Don't need my stethoscope anymore. Okay, so I'm going to go ahead and turn this off. If they are on oxygen, you're going to put them back to their baseline oxygen. But just so you can hear me really well, I'm going to leave it off for right now. Thanks, Lauren. Because like I said, I spilled, so This next skill, you have to remain sterile. You have the whole entire bedside table here is going to be sterile as well. All right, make sure that's good and clean. Okay, I'm gonna perform my hand hygiene. All right. So before I get started, I'm gonna open up my normal saline and I'm gonna open up my peroxide. All right. Only because I spill everything, we're gonna put this in the basin. And I highly suggest you use that too as well. All right, so I'm gonna get my kit. Now remember, this is sterile. So make sure you don't have your sleeves all the way down. You don't have your hair falling in it, right? Your hair tied back, pull it open. I'm gonna check and make sure I have a correct kit. Yep, it has my tracheostomy cleaning tray, has everything I need in it. Now, your kit here has multiple folds. It's there to help make sure you maintain sterility. So you're gonna pull it away from you first, okay? All right, and then just kind of turn it. You're gonna wanna use those adjacent corners that we talked about in the urinary procedure, okay? It's okay to turn, I promise, it's okay. As long as you're keeping an eye on your sterile field and your 1 inch border. All right, so this is where I need my glove fairy because I ain't gonna be able to put those gloves on. So take a little Hollywood break here for a second. Now they're all pretty and I can put them on. Thank you. All right, so I'm gonna go ahead, put my gloves on. Just leave it be. Don't touch it. Just let it go. Like Elsa says, let it go. All right, 2 sterile hands. Be very careful how you open up your kit. All right. Just lay it down. Just drop it. Just drop it. Just let it go. Okay, now in your kit you have several things. You're gonna have 2 basins, a tray, 3 pieces of regular gauze, 3 pipe cleaners, 3 Q-tips, a scrub brush. I call it a crab claw because I can't think of what it's called right now. Your trach tie and fenestrated or unraveled gauze. So we're going to get that all ready to go. I have basin 1, which will have normal saline. Basin 2 will have normal saline. Basin 1 will also have your peroxide. And then basin 3, which is just going to have a piece of gauze and just a tad bit of normal saline. So I'm going to make sure I put that above here. Here's your trach ties. So make sure that you look at your trach ties and they're not soiled and they don't need clean. All right, I got my scrub brush. Okay. And here is your unraveled or fenestrated gauze. Set that right there. Okay. My 1 piece of gauze in my tray, and then my other 2 pieces of gauze right here to help me dry it. All right, so I got to make sure I have everything set up. My sterile field is good to go. And basin 1, it's going to be half normal saline, half peroxide. Basin 2 is going to be just normal saline, and then just a little bit of normal saline in your tray. All right, so the hand closest to my patient is going to be my non-sterile hand, okay? So I'm gonna come over here and I'm gonna grab my solutions. So I have my peroxide and that goes in basin 1, okay? All right, do a little 2-step here. Don't be reaching over your sterile field, just 2-step, okay? All right, normal saline, and then just a little bit of normal saline. You don't need a whole bunch. Don't need a whole bunch. All right, make sure I got everything. Good to go. Okay, I'm gonna go ahead and take your inner cannula out. You're gonna unclip and you're gonna pull turn 90 degrees and pull gently out. Do not touch the patient with the inner cannula. And then you're gonna just drop. Okay, so you're probably thinking, Sarah, how in the world am I gonna do this? I only have 1 sterile hand. This is how you're gonna do it. You're gonna come here and you're gonna grab your claw, as I say it, and hand it over. make sure to remember you have your 1 inch, right? So if you're handing it over here, make sure you don't touch it except for 1 inch. All right, guess what? Now I got 2 sterile things again. It's great. So I'm gonna come in here, I'm gonna clean. It's gonna be soaking in here, and you want that peroxide and you want that normal saline to get down inside that cannula. The peroxide's gonna help clean all that mucus off, and it's gonna be nasty. So if you have one that has clips, you can just grab it just like that. If you have one that is circular, it might be a little bit more difficult. And you can see real quick right here, you can put the cannula in there. All right, just take your time, be gentle, don't be afraid to really grasp on your claw here, okay? Now we gotta scrub. So you're gonna scrub, scrub, scrub. And trust me, you will probably have to scrub really good with this brush, okay? And don't be surprised if you have to actually let it soak for more than just like the 30 seconds I did. All right, and get it really good. Make sure it's in there. I got it all clean. Okay, I don't need this anymore, so I'm gonna drop it, and then I'm gonna just rinse. Rinse, make sure you get the inside of that rinsed out. Oh, I'm gonna break my sterile field if I'm not careful. There we go. Okay, inside of it rinse really good. Okay, because I don't want any peroxide inside that cannula. All right, bring it over here. I'm gonna grab my pipe cleaners and I'm gonna dry the inside. Dry that inside. Okay. Make sure you get it good and dry inside. If there's so.
Oh my gosh, what would you do if this happened in real life?
I would have to go get a whole new inner cannula.
Okay, we'll get you one.
So, I got a whole new inner cannula and I'm on a new patient now. And it does happen. Okay. All right, we're gonna back it up. Thank you, Miss Linda. Okay. Here we go. We're backing up, right? Okay, so I'm rinsing after I scrubbed. Man, I tell you, today. Okay, now I got it good. Go over. Pipe cleaner. I want to clean my pipe cleaner to make it really dry in there. Get all. I'm done.
Sarah's gonna need a second attempt.
But my trach is still sterile. Okay. Third time. Let's put it in.
It's fine. This is unscripted.
Oh man. This is it. This is what nursing is, guys. You've got this. All right, it's dry on the inside. Awesome. Now I'm going to take my sterile gauze and I'm going to dry the outside really good. I'm going to get rid of this. Be careful. Pass it over. All right. Now I can put it back in the patient. I know y'all are laughing at me. It's fine. I laugh at myself every day. You have me in theory or lab, so it's fine. Ready? Okay, there we go. 90 degrees. And then you're turning and clipping. All right. Pull the dirty gauze out with your dirty hand. So now I no longer have a sterile hand, I have a clean hand and I have a dirty hand. All right, so I'm gonna put that, I'm gonna get rid of that. Now I need to clean. All right, so you see you have your pretty Q-tips here. This is where they're gonna get wet with that gauze. And we're gonna clean. We're gonna clean. All right, be careful. I'm gonna clean the ostomy from the outside, or from the inside out, from the top down. Drop. I'm going to do that over here as well. All right, drop. And then check the top and the top down. And drop. All right. Now I'm going to clean their faceplate. A lot of times the faceplate will also have dried mucus as well. So we get it. Clean it, and then just fold it in half. Just clean the other side. All right, that looks good. Okay, trach ties, they're not soiled, they're okay. Now I'm gonna get my unraveled or fenestrated gauze. Okay, and I'm going to replace it up here. There we go. Does that feel better? Awesome. Okay, I'm going to document everything. I'm going to document that I got a new trach, right? Because I got a new intercannula because I dropped it. But make sure that you're maintaining sterility. Make sure that if you do make a mistake, just like I did multiple times, I corrected myself and I did what was best for the patient, evidence-based practice, and made sure that their airway remained sterile. All right, you guys will do great.